The patient say no. Now I'm going to perform. Now I'm going to ask you some questions regarding your health in general. Is that okay?
Yes.
Okay. So I'll address you.
Oh my god.
Have you noticed any changes in your weight,
No.
appetite,
No.
sleep,
No.
bowel habits,
No.
urinary habits?
No.
Have you undergone any injury?
No.
Have you traveled recently?
Yes.
Okay. So where did you travel from?
Kansas.
When was that?
4 days ago.
Oh, that's great. Okay. Do you feel abnormally hot or cold when others don't?
No.
Okay. Do you have any headache,
No.
fever,
No.
fatigue?
No.
Oh, this was also a typical case. You know, usually the patient does not give you anything about general loss, and you ask every question. You ask every question with one word. Do you have weight? Have you noticed any changes in your weight? Have you noticed any changes in your appetite? No, that's wrong. Have you noticed any changes in your weight, appetite, sleep, bowel habits, urinary habits? 5 questions with only 5 words. I will suggest you to do this thing. Okay? Have you noticed? Have you noticed? Have you noticed? That will consume your time and that will irritate the patient as well. Okay. Now going to PAM Hub first. Now some questions regarding your health in the past. Have you ever had similar problems before? Are you currently suffering from any diagnosed medical illness?
No.
Yeah, I'm just briefly, uh, doing it so that I can make sure that every beginner has also listened to me. Okay? Do you have any allergies?
No.
Are you taking any medication? If he says yes, I'm allergic to penicillin. So what happens when you are given penicillin? Is that a skin rash or you get problem with your breathing? You will have to specify. Okay? Then, are you taking any medications
No.
for this problem? Have you ever taken?
No.
Okay. So what was the question of medication?
Are you taking any medications for this problem, or have you ever taken medications for any other problem?
Yes. Okay. Then, have you ever been hospitalized? If you have asked urinary and bowel habits in was but having fever, you do not need to ask this in PAM Hubs post. Then it becomes PAM H post. Have you ever been hospitalized? Now some question regarding the health of your family. Is anyone else in your family suffering from similar problems?
No.
Okay, thank you. And is there any chronic medical illness running in your family?
Hypertension.
Okay. So can you please tell me more about it? Who is having hypertension in your family?
My dad has hypertension for the past 5 years.
Okay. And how about the health of your mother?
She's in good health.
Okay, good. Just touch it. If the hypertension was relevant, go in details. If the hypertension was irrelevant, do not go in details. You have just to write father is hypertensive. Okay. Now I'm going to ask you some questions regarding your gynecological health. Is that okay?
Mm-hmm.
When was your last menstrual period, first menstrual period?
Are your cycles regular?
Are your cycles regular? How many tampons do you use on a heavy day? Okay, have you ever been pregnant?
Excuse me, what is the meaning of gynecological history? If the case is irrelevant to gynae, what is the meaning of the question?
When was your last menstrual period? When was your
Cycles regular.
Cycle.
Are your
Are your
cycles
cycles
regular?
regular?
Two questions.
And then any abnormal vaginal discharge you have?
No.
No.
This
We
is
have
never. This
so
is
many
never.
questions. What is the
OCPs
meaning
are
of
never
the- what is the
important.
Compare, in the post menopausal patients.
Yeah.
Mm-hmm.
In postmenopausal patients, yes, you should ask it as a part of minimum necessary gynecological history question. Okay, so gynecological history minimum is when was your last menstrual period? Yeah, just a second. When was your last menstrual period? And the second thing is, are your periods regular? If the patient is postmenopausal, when was your last menstrual period? Do you have any hot flashes, vaginal dryness,
HRT.
or spotting? 3 questions for postmenopausal. Yes.
Okay, this is regarding family history, right? So if I ask, is there
This is
any?
about gynecological.
No, I'm asking that about the family. So the thing is, if you ask like, is there anyone in the family with a similar complaint? He says no. And then we ask, is there any major medical illness in your family? He says no. And then do we have to ask, how is the health of your parents? Or how do we ask that question? for the
Well,
parents.
if the patient is more than 50 years old, you do not need to ask how
So
the health of
we
the
should not
patient.
ask.
Yeah. Okay.
Mhm.
Well, it's a difficult question as well.
Mhm.
Is there any chronic medical illness running in your family?
Mhm.
Is anyone else in your family suffering from similar problems?
Two questions.
Two questions for more than 50.
Mhm.
And if he or she is less than 50, you should ask about the health of your parents. That is my personal perspective. Because if he is more than 50, then most likely her parents are not going to be good.
So we should ask, are your parents alive, and then ask the health of the
Yes.
parents? That should be good, right?
Yeah. Any question? Yes. Yes.
Can we ask about HRT in postmenopausal?
Yes.
That
If
was a good
relevant.
question.
If relevant, if the patient comes with headache and you are going to ask for all of the obs and gynae history, you are wasting your time.
Hmm.
If the patient is a gynae case, you must have to ask it.
If the patient is allergic to peanut or almonds,
Okay, so I will advise you to avoid peanuts.
If I have differential diagnosis of cancer, can I ask directly to the patient that do you have any family history of cancer?
Yes, that is gonna be very good. If the patient came with weight loss and you are suspecting colorectal cancer, the very good question would be: is there any history of malignancy, cancer, colon cancer in your family? That will give you extra points. Okay, in case of amenorrhea, in case of vaginal discharge, in case of erectile dysfunction, you are not going to ask, is anyone else in your family suffering from similar problem? You are not going to ask that. These are very private issues, and you are not going to ask whether anyone else in your family is having similar problems. All of you guys listen to this thing.
Only I think hypertension, diabetes and cancer you can, that's what-
You can ask in, you should ask in each and every case except erectile dysfunction, except vaginal discharge, except you can ask in amenorrhea as well. But this is some very private things you should not ask. Now come to the. Now I'm going to ask you some questions regarding your personal health and lifestyle. Don't worry, everything will be kept confidential. Are you sexually active? May I ask with whom? How many partners did you have in last 1 year? Do you use any means of contraception? Do you use these methods consistently or inconsistently in case if you are suspecting a pregnancy? Do you smoke? Do you drink alcohol? Do you use any recreational drugs, not illicit? Illicit is a medical term. Counseling. Being your concerned physician, it is my duty to inform you that drinking alcohol is injurious to health and puts you at a higher risk of acquiring diseases of heart, stomach, and liver. So I will advise you to quit it. If you are ready, I'm always there to help you. Do not ask for, we have a very good program, that will waste your time.
are you willing to quit it? ये भी पूछ रहे थे।
If you are ready to quit it, I'm always there to help you. That's it. That is what I used to do, and I would suggest you to do.
If a person says that I'm in, what would be the response?
Okay, thank you very much. I really appreciate that. Move on to the next question.
And if the SP says that he or she smokes occasionally,
Yes.
so do you still counsel or do you just go on to the specific details?
1 cigarette a week counsel.
For alcohol,
2 glasses a day, do not counsel.
Okay.
3, 4. More than
If 3 glasses per day, go for counseling. If binge drinking per 1 month, go for counseling.
You should ask age first,
Age.
then counsel.
Yes.
If he is 2 by 4 or more than 2 by 4, then counsel or it,
If glasses are more than 2 kg, then counsel.
Counts.
and if the cage is 0 by 4.
0 by
he
4.
drinks tons of alcohol, but cage is 0 by 4. Then
Yes, you should counsel. Kashi. Yeah. Okay, you done?
I had same question.
Okay. Very briefly.
So one thing can you please elaborate on the consent of HIV when to take that in sexual history, or what are the different situations in which you can go for the consent for HIV testing?
Okay, polygamous, multiple sexual partners, more than 2 in 1 year, last 1 year.
At one
Go for
time or
counseling.
like in different time periods? Like he
Last
says
one
one
year.
in 6 weeks and one in
More
3
than 2
months.
partners, just okay. More than 2 partners in last 1 year, go for HIV testing. And with your permission, I would also like to test you for HIV. Your current sexual practices put you at a higher risk of acquiring. Yeah.
If he is polygamous during last 1 year, but he uses contraception consistently, should we ask about testing for HIV and STD?
Yes.
More than 2 partners or more than 1 partner?
More than 2.
Like if he has 2 partners in the previous year.
Yes.
If he's using
You are
condoms
gonna
regularly,
count
even
Yes.
If,
More than
if,
2.
if he is using condoms.
Yes.
then
Again,
if it is
Okay.
go for it.
Okay.
High risk sexual practices.
If patient has multiple sexual partner in 1 year and using the condom consistently, and we can make a diagnosis of HIV in that patient
No.
in our different.
You are going to test for HIV, but you are not going to make a diagnosis of
If the
HIV.
case, this is the case of
This is
weight
the case.
loss, and we have only one clue is that a multiple partner, but he used condoms on a consistent basis. We should inquire more about how often have you ever done
What kind
intercourse
of
without
partners?
the condoms,
What
because
about the partners?
you will get a clue of HIV only in sexual history.
The thing is, if you are having high risk sexual practices, that means more than 2 partners in last 1 year, go for testing and counseling of HIV. Simple as that. Okay? If he or she is using condoms regularly or irregularly, doesn't matter, go for testing.
Don't you ask that have you ever been tested for HIV first?
You will ask. You should have to ask if I have missed it. So briefly, the description of last 1 hour. Okay, starting from introduction, I am going to perform a case in front of you guys. Okay, so this is gonna be a case of pain. Okay,
Yeah.
Miss Smith. Hello, Miss Smith. I'm Dr. Shabbir. Nice to meet you.
Nice meeting you.
I'm your attending physician here today, and I'll ask you some questions regarding your health and perform a brief physical examination. Is that okay?
Sure.
Are you comfortable here?
Yeah, doctor, I'm fine.
Okay. I hope you won't mind if I make notes while talking to you.
Not at all. Go ahead.